yes, absolutely. I will repeat it again. I'm glad that I came to see you, and I'm glad that
Mhm.
you recommended me this type of treatment. And I followed your advice. And at the end, you gave me my joyous life back, my
Oh,
life that I lived before all this started go down.
wow, wow.
Very, very happy with the results.
Oh my gosh, thank you. Hello, this is Dr. Taiwo Durowade from Dardur Gynecology. I'm here to do a testosterone testimonial with one of my wonderful patients. Her name is Irina. Irina, how are you doing today?
Hi, doctor. I'm doing good. Thanks for asking.
Absolutely, absolutely. So, Irina came to the office and she was telling me how good she feels. So I said, okay, can you do a Zoom video for me? And she said, yes. So that's how we're here today. All right, Irina, how did you find me? How did you know to come? Where did you see me or where did you find me?
Um, I Googled your practice.
Ah,
I was looking for a gynecologist close where I live. So I Googled your practice, and I was due to do my annual pap smear. So that's
mhm.
what was my main reason to come to see you.
Okay, perfect. And then at that visit, I'm pretty sure I asked you questions about menopause. Do you remember? Well, let me say, what kind of symptoms were you feeling that started us down this path of hormone replacement?
I I felt irritated. I felt
Mm,
impatient with people around me.
mm,
I I had some uh, de depression symptoms, some
mm.
anxiety symptoms, and of course, my sex drive was very low.
Okay, okay. Yeah, and one of the things I do when I do annual pap smears is I ask these types of questions. There's a questionnaire in the office that I have you fill out, and if I'm seeing your numbers of those symptoms to be high, then I start talking about doing labs to find out if you're in menopause and if there's something we can do. How would you say your experience in the office was? How did you like the office experience?
My experience was excellent. I like
Mhm.
I like everything in the office, and no complaints.
Thank you. Thank you. So what made you choose the pellet? Because I gave you like different options. What made you choose this one?
Well, I heard from different women about their experience with pellets,
Okay.
and I thought I'll try it and see if it helped me. So
Okay.
that's why I chose pellets.
Okay. Great. Great. Sometimes hearing from other people that they've had good experiences, good results, helps to make you sure that you want to do it. So that's great.
Right.
How was the procedure, the insertion? How did it feel?
Uh, it felt okay. The, for me, no pain at all. But
Oh, nice.
yeah, maybe some people will say that they they felt some pain, but for me, no pain. Just maybe the next day, some kind of maybe tenderness
Okay.
inside the area of the incision or
Mm-hmm.
injection,
Mm-hmm.
but otherwise, everything was very good.
Wonderful. That's good. That's good. Because some people are afraid of needles, they're afraid of incision. So letting them know that it's not a big deal. It might be
No,
sore. Yeah. It might be tender, but it doesn't last long. Like, how long did your pain last? The tenderness, how long did it last?
Maybe just 1 day.
Wow,
1 day. Yes,
that's
yes.
great.
I kept that bandage on my
Mhm.
side, and the next day I removed, and that's it.
Wonderful.
I
That's
felt
good.
great.
That's good. How soon did you start feeling better? How soon did you start noticing that your mood was better?
I noticed some changes in 3 days.
Wow.
Yes,
3 days is awesome.
yes.
I tell people like, okay, 1 to 2 weeks. So 3 days is excellent.
It started gradually increasing. Like
Nice.
I felt some changes in 3 days, and after 3 days, I felt more. So maybe
Wonderful.
in a week, I felt like normal.
Oh, good.
Mm.
And how was the sex drive? Was there any improvement in the sex drive?
Yes, it was. Was. Yes,
Wonderful. And you felt more stable. Your mood was stable.
yes. Less anxiousness,
Mm,
less irritability,
mm,
uh, more happy feelings. Like
mm.
feelings to I'm glad that I'm alive. I want to do things.
Um, Wow.
Yes,
That's powerful.
yes. This this type of feeling. Yes.
Oh, that's such a powerful statement. Thank you for sharing that. Wow. I had to absorb that. That was awesome.
Yes.
Wow. And you mentioned something in the office. Yeah, you said it already, that you're happy you're alive, that I made you feel alive again. I wanted you to share that.
Yes, I will. Yes, absolutely. I will repeat it again. I'm glad that I came to see you, and I'm glad that
Mhm.
you recommended me this type of treatment, and I followed your advice. And at the end, you gave me my joyous life back,
Oh,
my life that I lived before all this started go down.
wow. Wow.
Very, very happy with the results.
Oh my gosh, thank you.
You're welcome. You're very welcome.
Thank you. And so the last question, will you advise any woman to get this? I'm sure the answer is yes.
Yes, I will advise uh, every woman who has some symptoms like I did to try hormone replacement therapy and see if it help to ease off the symptoms and continue to live happily
Yeah,
to the fullest.
absolutely. And that's what I truly believe is, menopause makes you not everybody can make you feel like you're losing yourself. And so, and the cause is you're losing your hormones. So let's give you hormones back safely so that you can live your joyous life again. You can be happy to be yourself, happy to do things, wanting to do things, spend time with your loved ones. It's so important. So important.
Absolutely. Absolutely, yes.
Oh, thank you so much. This is so great. I'm so thankful for your time and for such a powerful testimonial. Thank you, Irina.
No problem. Anytime, doctor.